I have been a Wendy Williams fan for years. You guys know this. Wendy Williams has recently gone on TMZ talking about a number of things, her new endeavors, but also her lymphedema. As you guys can see from this photo here, she actually is showing the folks on TMZ her lymphedema. That is the swelling she has in her foot. You can see that she's holding her foot up. She's got some swelling, some darkness of the skin. Edema is also another word for swelling. We're going to talk about exactly what lymphedema is, what's going on. I do appreciate Wendy sort of talking about her journey because it raises awareness about a condition we don't always hear about. All right, guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert and video creator. Yes, Wendy fan for years I have been. I told the story before when I was at Princeton. She was on Hot 97. My roommate and I used to come home at the end of the day in the afternoon and turn on the radio and listen to her on Hot 97. So loved listening to Wendy. I've followed her career for years. So lymphedema, let's talk about this. Not the most common, but it does happen, okay? And it can happen in people with certain medical conditions, with certain underlying things. Let's start with that because I think a lot of people are like, wait, when and how does this happen? So a few things can cause lymphedema. Infection can cause it. It occurs in cancer patients, either from the cancer itself or because of the radiation treatment people are getting, or maybe the removal of lymph nodes that they have. They can get lymphedema as a result. Inherited conditions can also cause lymphedema as well. I mentioned radiation for cancer, but also parasites can actually cause lymphedema. This is something that we see more in developing countries than we do see in the United States. There are other causes as well, but this is just a little bit of a guide. Now, I know you're probably saying, what in the world is lymphedema? I don't even understand how this works. Basically, lymphedema, and once again, as you can see here with Wendy Williams, this is her leg as she shows it, her foot rather, she's got the swelling there. Basically, lymphedema is a type of swelling, which makes a lot of sense by what we're seeing, okay? Basically, when lymph builds up in the body's soft tissues, that's often what we think about when we think about lymphedema. Lymph, you're saying, well, what's lymph? Basically, it's fluid that's filled with white blood cells. White blood cells are cells that fight off germs, so it's part of like your body's immune system. Lymph is something that needs to flow and do its thing. It needs to flow around in your body and sort of do its job. However, and it's usually drained throughout the lymphatic system. It's the lymphatic system, lymph nodes, lymph, you see that word is all around. That's the system that deals with lymph fluid. However, if the lymphatic system becomes damaged or it becomes blocked, that lymph fluid, the fluid with the white blood cells, can build up, and then we can get what we have seen. Once again, here, this is a photo from TMZ of Wendy Williams and her lymphedema, okay? So lymphedema can happen in many parts of the body. It can happen in the arms and the legs, but it can happen in other parts. It can happen even in the private areas, genitals, fingers, I mean, you name it, it can happen in other parts. Arms and legs are pretty popular, rather pretty common, I should say, when it comes to this. The other thing is what you tend to see with lymphedema is there's a feeling of heaviness and tightness that usually people have, and that makes sense because if you've got all this fluid that's built up in the soft tissues, the skin's going to stretch and it's going to become tight. It's kind of like if you're just swelling in your lower extremities because of a hot day. You may know what that feels like. It feels tight. Well, lymphedema can cause that tightness as well. The skin can get hardened and thickened, may change colors, turn darkened. Some people actually get restricted motion where they can't really move as well, and there's ranges of how severe this condition is. There's mild varieties. There's more severe varieties as well. But you know, I think a lot of you guys are probably wondering, you know, what's the treatment? Is there treatment? Yes, there is treatment. It usually consists of a number of things, right? We obviously want to deal with the underlying cause. If the underlying cause is something that can be fixed, that may be one option. But other than that, there's exercises that are often done or prescribed. Certain types of massage to help with the lymph fluid and getting it where it needs to go, or hopefully helping to promote that. Compression devices. Wendy Williams has actually talked about compression devices and using them, or compression stockings or wrappings. So wrapping the joint or the limb, etc., to sort of try to keep everything in and promote resorption. Also, skincare. You got to really take care of your skin if you have something like lymphedema as well. There are other treatments as well. This, again, is just a 50,000-foot view of what lymphedema is. I definitely want to thank Wendy Williams for sharing her story with the world, because I think it sort of raises awareness to something that we don't always hear a lot about, and also hopefully will help us in general. As always, if you guys have questions, make sure you're talking to your doctor. It's so important. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. For those of you who are watching me on Facebook, please like and follow my page. Also consider joining my subscription groups. For those of you on YouTube, hello, please subscribe to my channel, click the little bell for updates. And for both of you, check out my website, drjencaudle.com, where I actually have an exclusive offering, Dr. Jen's Daily Health Tips, with a 7-day free trial. You can get actually what I think are helpful tips to help you live a healthier life every single day in your inbox. Guys, I'm Dr. Jen. Oh, and by the way, let me know what you think about this video, okay? All right, guys, I will see you soon.